When it opened its doors 40 years ago, the Baton Rouge General's Regional Burn Center was just one of 14 nationwide. Today, it still stands as one of the best.
Most of these patients have accidents, and they were going about their normal activities of life when something tragic happened.
As an injury, burns can be particularly tricky to heal. A burn damages the body's largest and often overlooked organ, the skin, which is made up of 3 layers. Burns are measured in degrees. Most everyone has experienced a first-degree burn, like a sunburn.
A second-degree burn goes through the top layer and a portion of the next layer called the dermis, and a third-degree burn goes through the entire thickness of the skin all the way down to the fat or the muscle below.
The more severe the burn, the more difficult it is to heal. That's why every member of the staff here specializes in burn care. Significant damage to the skin, which is the body's first line of defense, also leaves patients incredibly vulnerable to infection. In the burn unit, certain steps are made to protect patients, including a sterile wing.
It can be a prolonged, protracted treatment and recovery process. It's very important that we treat these patients with physical and occupational therapy, as well as psychosocial support as well.
One of the unique things about the burn center here is that the treatment of the patient goes far past the emergency situation. They also help with the emotional healing as well as the physical injury.
We just have to make sure the patient realizes they're still a person, they're still a human being with feelings, and we have to support them through the difficult time of recovery.
And each recovery is celebrated by staff with a yearly Burn Survivor Banquet. For Healthline, Elizabeth Vowell, WAFB 9 News.
The Regional Burn Center at Baton Rouge General treats around 3,000 children and adult patients each year. And today, there are 125 burn centers nationwide.